I get people asking me about lower back pain and stiffness in their lower backs quite a lot. And one of the things I often end up talking with them about is pelvic tilt. And what the different positions feel like, or whether they're able to get into these positions. And by that I mean, are you able to tilt into an anterior tilt, so tipping the pelvis forward, versus the posterior tilt, so tipping the pelvis backwards, or knowing where the neutral line sits. So the good way I once was told to find the difference between these three is to imagine that with the anterior tilt, it's like you're pretending to be Donald Duck. So you're trying to stick your tailbone up like a duck. So you're tipping that pelvis forward and you're creating that tailbone to come up towards the ceiling like a duck. Whereas the posterior tilt is imagining you've got a tail attached to your tailbone and you're tucking it under yourself between your legs, just like a dog would when they tuck their tail to sit down, or if they're scared, they tuck that tail and that rounding in that sort of posterior chain. Whereas neutral is the midway between the two. So to find that is imagining yourself a bit like a T-Rex, and you have that T-Rex tail. So you have that extension from your tailbone down towards the floor. So you create that tripod between your tailbone and your both your legs. And the neutral position is if you were pushing between those three. And that's how you can find the difference between anterior, posterior, and neutral for the pelvis tilt. And working between these, I find helps that lower back pain